webinars. Great to have you here with us. I'm going to do a couple of minutes blurb and intro, and then I'll introduce Hannah Gillespie, who's going to be talking about planning a career in educational research. And I'm going to watch with interest and find out all the mistakes that I could have avoided if I'd listened to her talk about 30 years ago. So looking forward to hearing that from you, Hannah. So just as an introduction, many of you hopefully will know about the incubator, which the NIHR funded in clinical education research, and it's to try and encourage more research in this area. We've offered lots of different things over the years at different levels. This is very much a getting started, so this is more for those of you who are starting at the beginning of your research career rather than towards the end of it. But everyone is, of course, welcome. A couple of things to say is that the video, the recording of this, will be uploaded onto the website in the next week or so. So we don't send them to you individually, but they'll be accessible. And in fact, this is the last of the academic year series. And so all the other things on how to write a research question, how to do interviews, focus groups, quant analysis, qualitative analysis, etc., all those things are on the website. So do have a look on the website for that. A couple of things introduction-wise, because there are probably too large numbers to go around to everyone. We normally suggest if people are happy to put their name and who they are and where they work on the chat box as we talk. It'd be great to find out where you are and who you are. My name's Hugh Alberti. I'm a GP and Professor of General Practice Education at Newcastle University. Great to see and meet you all. A couple of the just practical things. We'll be doing predominantly a talk for the first half hour, but if you have questions as we go along, please feel free to put them in the chat box. And then at the end, there will be a time for a Q&A session. And then if possible, get you to ask the question yourself and put your video on, but otherwise no need to put your video on in the meantime. And just to say, if you have any feedback for us and or need a certificate for your attendance, then Marta, our fab assistant, will put that in the chat box as an email address, as well as the website for the other videos as well. I think that's everything I need to say. I'm not sure why we're just struggling to get one person in, but I think they're finally in. So hopefully that will stop beeping on my computer and yours as well. And I'll now hand you over to Hannah to introduce herself and tell us how to develop a career in educational research. Over to you, Hannah.
Thanks a million, Hugh, and thank you so much for the invite to participate in the series, because it has been a wonderful series so far. My name is Hannah Gillespie. I am a clinical lecturer at Newcastle. I'm also a kidney doctor in my spare time, so I spend half my week as a kidney doctor in the Freeman, where I'm interested in organ donation and transplant, and the other half of my week as a clinical education researcher with the team in the School of Medicine at Newcastle. And today I've been given the really hard job about thinking about how do you actually build a career in clinical education. And over the next few minutes, I want to do a few things. I want to tell you a little bit about who I am, a little bit about what I do on a day-to-day basis, then think about how I actually do it, and finally, more practically, thinking how might you do it and what might some top tips be. I'm sure you're all here, you've been in the series, you know lots about what education research is. I work within the incubator, and at the very start of the incubator, we spent quite a lot of time thinking about what clinical education research is. And we settled on this definition, that this is research which contributes to the health and care needs of society by enhancing the education, training and development of health and social care practitioners and the structures and contexts in which they work and learn. And that's a pretty long definition. It's a pretty nebulous definition. And when we think about what we actually do on a day-to-day basis, we think about research which spans the continuum of health professions education. So it thinks about before you get into your undergraduate training, throughout your undergraduate training, what happens when you actually graduate and qualify as a clinician, and how does your ongoing development once you CCT within medicine or once you find your permanent post in another clinical career. What actually happens? We think across professions, not just medicine, but thinking dentistry, nursing, midwifery, and the allied health professions. We also think across geographical boundaries. I don't work just within England or just within the UK, but often try and take more global context to my work. So really, it's an interesting landscape. It's an interesting thing to do. And hopefully that's why you've been at this series and have been involved for the last few months. So I said a little bit about who I am. I'm a researcher at Newcastle, and my research work focuses on sustainability of the medical workforce. I'm really interested in why people make and choose career decisions, why people choose to continue on an academic career, and what things make those easier or harder to do. I'm in the middle of my training as a renal registrar. I also hold some external roles, so I'm the director of events at ASME and hope that I might see some of you in a few weeks' time at our annual conference. And for the last few years, have been the co-lead of training at the Incubator for Education Research, working with Hugh and Marta and some of the rest of you on this call. And when we think about planning a career, I think it's often quite helpful to reflect on my career journey, because I certainly didn't think I was going to be sitting here when I started out on this pathway. I started out in 2015, which is over a decade ago, which feels absolutely awful. But I started off as an intercalated BSc student in Belfast. I was the first student to choose to do medical education at that time as part of an intercalated degree. For the next few years, as a final year clinical student, I'd done some research into workplace learning before taking a place on the academic foundation programme, or now the specialist foundation programme in Northern Ireland. And over those 2 years, I thought a lot about prescribing and done a lot of work around undergraduate prescribing education. Directly after my F2 placement, I wasn't quite sure what I wanted to do clinically, but knew I really, really wanted to do something within the field of education. I went off to Maastricht at that time to do my PhD in medical students' workplace learning. I came back, I'd done 1 year as a clinical trainee in Belfast, and then had some discussions through the incubator and decided that Newcastle was a really fun place to come with lots of great education research, and ended up taking an NIHR academic clinical fellowship to think about workforce and postgraduate training. And after 2 years in an ACF post, transitioned into a clinical lectureship post. And I'm aware that that looks like a beautifully linear trajectory, but in reality, it has looked a lot more like this. If it would navigate forward. It's looked a lot more like this. And there have been lots of times in that pathway where I've had no idea what's going to come next, or if anything did come next, if anything was going to come next. I wasn't quite sure where the funding was going to come from, or what on earth I was going to do in 1 year's time, 2 years' time, or 5 years' time. But what I had done when I look back on what looks like quite a linear path, I had mapped my research to problems that I thought mattered. And I'd done work that interested me with people who were really interesting and engaging, and people who were supporting me to do things that I was interested in. And as an undergraduate student, I was really frustrated that medicine was really tick boxy and that I was being forced to jump through hoops. And that's where my love of education research started. As a more senior clinical student, I thought surely we can improve how we actually learn in these placements. And that brought me down the road of workplace learning. As a foundation doctor, I was terrified to prescribe paracetamol. And that conversations with the research team, we started to think more about learning how to prescribe in practice and how that built upon my skills in workplace learning. That eventually led to a PhD, which thought a little bit about prescribing. It thought a little bit about other tasks that we learn how to do in practice. And then at the end of my PhD, I decided I was probably more interested in the postgraduate landscape as a postgraduate trainee, and thought, why are so many of my colleagues actually leaving training? Why are we all a little bit unhappy? And doctors are leaving. So what can we actually do about it? So I think that from my perspective, I've been interested in lots of different things, I've managed to work with lots of different teams, and really I've built a career from going from interesting question to interesting question with no real planned path, which probably isn't the best career advice you can ever give, but we'll come back to that. I think it's fair to say that it's really important to think about why you're interested in anything that you do or that you choose to do. And an academic career isn't easy. And I think it's important, to my mind, to think about why I'm actually interested in clinical education research. I think when we go into practice, it's quite easy to be despondent about the state of medical education and training, particularly in the NHS. We see that there are significant issues with recruitment at an undergraduate level. We know that on the opposite end of undergraduate training, people are planning to leave quite quickly after they qualify. We know that there's intense strain and competition for resident doctor jobs, which many of you will know far more about than I do. And we know that our clinical staff are increasingly burnt out. We also know that it's a very real fear of unemployment for our resident doctors in the NHS. And that even with all of this, we're still considering leaving. And I think when you see headlines like that, it's really easy to be despondent as a resident doctor. It's really easy to think it would be easier to give up and leave. But I also think that that means it's a really important time to do good education research. It's a really important time to think about how the questions we ask can impact policy and practice, and also how we can make a really meaningful change to those who come afterwards. I don't think it is all bad. I think these are really important problems. I think they attract national and international interest. And there is the possibility to meaningfully improve opportunity for individuals, to improve the working lives of those that we work with, and also to improve patient outcomes through, first of all, safe staffing, and also education and training. So that's a shameless plug for clinical education research. And then comes down to this question, which I'm asked quite often in my clinical work. What do you actually do when you're in the university? I often say I work on important problems with interesting methodologies with absolutely great people, and that our aim from my work is to influence and inform practice, policy, and practitioners. And this is the kind of work that we do. This is the training pathway that many of you will be very familiar with. And our work in the team at Newcastle looks across the pathway to try and think about how things might be slightly better. We're thinking about who actually chooses to do an academic career. Is it different if you're from a different background? And how might that impact our recruitment practices at an early stage in academic training? We're thinking about the change to preference-informed allocation, how that actually affects career ambition, and then what might we actually do about it? What might a perfect SFP post be like, and how could we design that within the constraints of our NHS today? We're also thinking a little bit about why do doctors leave training and what can be done to help keep them there if that's the choice they want to make. And also thinking about clinical academic careers. Who would choose them? What are the barriers? And how can we do things a little bit better? I think one of the best things about this work is that I work not only with other academics, but with a really diverse range of stakeholders and collaborators. We often work with patients, work with members of the public, with resident doctors who are often my colleagues in a clinical setting, with educators, with professional support units, and then also think about a more national approach, working closely with Royal Colleges, with some charitable organisations, and also the national educational leaders, for example, the UK Foundation Programme Office, NHS England, and the GMC. So it's an opportunity to do research which matters and to work with some really interesting people. And then comes down to the important bit. How might you do it? I think it's fair to say that very few people have a traditional academic path. I've come off an interview this morning with different academic trainees at a senior portion of their career, and we reflected that none of us really had taken the path that we were meant to take, but it had somehow worked out. And I think this slide, which I showed earlier, really does represent that well. It often feels very messy, it's very uncertain, but it does feel like it's somehow going in the right trajectory. I think at the beginning of your career as a student, there are probably a few very key steps which can really propel your academic career. I think the first are student selected components. Not only student selected components in clinical education or medical education, but also thinking about how you can do good research in an SSC that will build those transferable research skills to other settings. Another wonderful opportunity are student internships, be they through Inspire, through the NIHR internship programme, or locally funded student internships, which give you a beautiful amount of time to work with a research team, build a project, and do something quite meaningful. I know in Newcastle, we're lucky that a lot of those are led by students and allows students to really define what they want to do over the course of their summer studentship and start building their interests early. And finally, a shameless plug for an intercalated degree, which is a wonderful opportunity to step off your normal pathway and do an intense period of research, which builds the skills that you might need going forward in your career. And I think it would be wonderful if those were in clinical education research, but lots of us develop transferable skills from other areas with other methodologies that they can then build in their future career as a clinical education researcher. We are the NIHR incubator for clinical education research, and a lot of what we have done is about building capacity for clinical education research within the NIHR framework in England. I think this is the most simplified version of the fellowship offering that I have seen. And I think it's excellent because it shows there are pre-doctoral stages, which is before you get your PhD. And those are available across the healthcare professions. For medics, we've got academic clinical fellowships or in-practice fellowships. For other healthcare professionals, that might look like a pre-doctoral clinical academic fellowship. And that's a brilliant opportunity to buy out time for you to develop your PhD proposal. Again, we have your time to do your PhD, followed hopefully by what would be a postdoctoral award, be that a clinical lectureship, a fellowship, or a skills and development award. I think that it's often easy to be a little bit despondent about the funding landscape, but I would encourage anyone on this call, particularly those in England, to have a look at the NIHR offering, to see what there is. And I think often there are many more pots of money than we might imagine from a first glance. And I think increasingly we're developing a real skill base within the UK community for applying for these awards. And there are lots of people who are very happy to share their skills and experience. I am aware, however, that there's probably lots of people on this call that are not quite on the pathway. Not time to panic, but actually time to discuss with a friend, a supervisor, or a mentor. Think about what part of that pathway you might want to join, or if you want to take a completely alternative pathway, to make a plan and to apply. And I think I would encourage anyone who's interested in a clinical academic career, particularly in clinical education research, to apply. You will eventually want to do a PhD. Start thinking about where you want to do it, where in the country, and also where in the topic area, when you want to do it, apologies, and how that might fit in with your clinical training plans, and who you'd like to do it with. Who are your dream supervisory team? Who are your dream mentors that you can bring along on that project? And again, important to think that there's lots of different places that can buy you the time to do that. Be that charitable funding from a particular specialty, local funding from universities, specific doctoral awards, and this is a shameless plug for the ASME Doctoral Fellowship, which offers stipendiary support, and then your more routine national awards, like an NIH or Doctoral Research Fellowship. Throughout the rest of your career, some tips for those who are just starting out to those at my stage. I think it is important to build your funding trajectory alongside your clinical academic career. I think there are lots of small pots of money which are really useful to get projects off the ground. And again, the ASME small grants are a wonderful opportunity for up to £5,000. And we often offer in the region of 10 to 15 of those each year for small, discrete projects, which will allow you to build a history as a fundable researcher and also to deliver on some cool projects that you're interested in. I'd also encourage everyone on the call to gain wider experience, not just doing research, but thinking of doing some peer reviewing for journals, in which every journal is desperate to have you. And often it can be a really nice chance to do those with a peer. So to sit down, 2, 3, 4 people together, discuss a paper that's been sent for review and to learn from that together. There's opportunities to then build on that and to gain experience in journal editorial capacities. And another shameless plug, but also identifying opportunities for you, that the Clinical Teacher have their New Voices in Health Professions Education Award, which is opening in a few days' time. And that's a wonderful opportunity to work with the editors of the Clinical Teacher, to gain some editorial skills and to learn a little bit more about what happens at the other end of a journal. I'd also encourage anyone to join some of the clinical education research committees, be that JASME, the Junior Association for the Study of Health Professions Education, TASME, the trainees body, or DMEG, the Developing Medical Educators Group. These are brilliant opportunities to work with people across the UK who are also interested in clinical education research and to start building your network in a really meaningful way. And finally, I'd say go to conferences, but also recognizing that's a little bit of a financial barrier, often difficult to get study leave. Most conferences are crying out for volunteers, and we'd be delighted to have someone who's interested in clinical education research, who's there, who's often offering a little bit of their time to support the conference delivery. I'd also say win some awards. And by that, I mean apply for some awards, because if you're not in it, you certainly can't win it. And I would direct all of you to have a little look on the ASME Awards page. We give out quite a lot of money each year. Particularly, I think if you're a medical student, think about the Sir John Ellis Prize, which is specifically for medical student or undergraduate projects. And if you're a little bit further in your training, thinking about the TASME Teaching Innovation and Excellence Prize, which are both brilliant opportunities to win national awards. And we would love to see some more submissions. And finally, don't forget about your clinical training, which is also important and builds towards a clinical academic career. So if I was going to reflect a little bit and think about what my top tips are, I think there are 5. My first would be find a problem that's important to you. And I think as clinicians, we're perfectly situated to understand what some of the challenges are. We often understand exactly why they matter because they matter to us. It can be a little bit more difficult to articulate that. And I think there are informal PPIE opportunities around every corner. So talk to your colleagues, talk to your patients, talk to your seniors about what you're interested in doing. And often that will help shape the development of your research project. I think it's much easier to do work that really matters to you versus work that you don't really care about. So finding a problem that's important, at least to you, will help propel you when things get a little bit tough. My second top tip would be find a wonderful team. This is a picture of Team Newcastle, who are a fantastic education research team. And I think particularly as a novice researcher, think strategically about building your team. That might be someone who has specific subject expertise in your specialty of choice. It might be someone with methodological expertise who can help you understand how to do that research, or it might be a gatekeeper who can help you access a specific population or access a specific group of people. I think building your team takes time, but working with great colleagues makes everything infinitely easier. And what you want to do is build a team that you can work with again and again, and bring new people into that to grow your capacity as a whole. Top tip 3 is to engage with others. I think that's really important because it changes the questions that we might ask. It often changes how we actually do our research. It allows us to think really meaningfully about how do we actually involve participants with different perspectives. And also think about how do we actually translate the research that we do into anything that's meaningful at the other end. So I'd summarize that as get the problem right, get the right team, and then do things that matter with the people who it matters to. And I think that if you continue to do that, regardless of what everything else is happening in the funding landscape, you might find that things just propel in the right direction. We're in no ways naive to the fact there are significant challenges to being a clinical academic. This is a tricky route. There are lots of uncertainties across the pipeline, but I do think it's a career which is really worth it, and often offers really nice opportunities that don't exist with a purely clinical career. My optional 4th and 5th top tip. Number 4 is publication certainly isn't the only goal. Some of my most impactful research projects have never seen the eyes of a journal publication, and I don't think that's a terrible thing. Think about other alternative formats to share your work. Think about doing things that are slightly more creative, and think about involving your participants again in disseminating that research. To my mind, the outcome of a really good research project probably isn't a published paper, but often it's the conversations that happen as a result of that work, some of the policy change that might happen in 5, 10, 15 years' time, and also the further projects that it builds towards. And finally, we recognise this can be a bit of a slog, so do something fun. I particularly like jumping in the sea and swimming as far as I possibly can, which gives lots of time to think about these research projects. But I would also encourage all of you to maintain that sense of fun and do something that's not clinical academia all of the time. So Hugh, I'm going to finish there. I'm very happy to take questions now, and would also be happy to talk to anyone via email if that's helpful.
Fabulous. Thank you, Hannah. That was I really do wish I'd heard that many years ago, but thank you, Hannah. That's absolutely perfect. And without having discussed this before, I think my top tips would have been very similar indeed to yours. So really, really appreciate that. We will now have a session of time, but if people have got questions, then now is the perfect time to either write it in the box or preferably pop your hand up, and then we'll get you to ask the question verbally. I'll just add a little anecdote to finish with. My predecessor here at Newcastle, doing the same role as myself, his retirement talk was called Serendipity, and it really was just happened to be in the right place at the right time. And I think probably about half my career, I would say, was serendipitous, but the other half has very much been, even though I haven't, follow the arrows that Hannah showed us on that great slide, but consciously thinking, actually, I will do this and do this because this is something, mostly because it was something I was interested in doing, but also just because I knew that would be the kind of the direction that would put me in a good place to get good opportunities to do things for myself and also for the teams, people I supervise. So I do think there's a much, even if it's a virtual career pathway, it's definitely, there's more of a structure now than there used to be, but also you can join that at any time. So I got into clinical education in my early 40s. So I can't see many people, so I can't see whether you are mostly under 40, but I'm guessing most of you probably are. So never too late. So yeah, thanks ever so much, Hannah. And as I said, the slides will be up on the website within the next few days or week or so. So anyone got any questions at all that they would like to ask? That's fine. Certainly don't need to force anyone. So maybe finish with Hannah. So you've given us a few top tips, but if there's one thing you wanted everyone to go away to think about, what would it be? Putting you on the spot.
I think I would say think about something that matters to you, because that's when things get interesting and that's when things get fun. And that allows you to do research that matters, that motivates you, and actually allows you to do something that, even if it's only you that thinks it's interesting or important, that's often enough. And then you can convince others with that passion. But it's much harder to do that if it's something you don't care about.
Absolutely. And we would have to admit there are times, like in any job, there are boring aspects of doing research. And I'd definitely say filling in application forms or ethics forms, maybe not the highlight of my life. But if it's something I'm actually interested in and really want to know the answer to, then I will do the painful bits so that I can get to the other end. So I completely agree with that. So, well, thank you very much indeed for coming. As I said, I think, Marta, if you don't mind putting on the website and sorry, the email address. I can't see it on the chat box yet, but we'll pop that on the chat box. So is that all right, Marta?
Yeah.
Brilliant. So if you do need a certificate or any feedback on the session, it would be great to hear from you. Otherwise, do have a look on the website for both this session and for the other sessions as well. I would recommend it. And basically follow Hannah's top tips. And hey presto, all sorted. But thank you very much, Hannah, and thanks everyone for coming.
Great to see you all. Take care.